Ultrasonic instrumentation plays a key role in the prevention and treatment of periodontal disease. The use of ultrasonics continues to grow amongst clinicians. Proper use during treatment and following infection control standards for reprocessing is essential for optimal clinical outcomes. This video is provided by Dentsply Sirona and is to be utilized as a guide to enhance the clinician's knowledge of the maintenance and disinfection of the Cavitron Plus ultrasonic scaling unit, its surrounding surfaces, and instrument reprocessing. This informational guide is not intended as a replacement for the Cavitron Plus ultrasonic scaler with tap-on technology and Cavitron Inserts Directions for Use Manual, or DFU. Always check your manufacturer's guidelines for recommended use of equipment. After utilizing the Cavitron Plus ultrasonic scaler, it is essential to disinfect all of the surfaces of the unit and its surrounding environment in between patients. This important step will reduce the risk of cross-contamination. To begin, remove the used Cavitron ultrasonic insert and secure it in a cassette or transport container. Hold the handpiece over a sink or drain and activate the purge control button. The purge function will run for 2 minutes. This function will flush out any stagnant water that remained in the lines overnight and releases any air bubbles that may be trapped in the handpiece. Per the CDC recommended guidelines, the handpiece line should be purged for a total of 20 to 30 seconds in between each patient. This allows any patient material that may have entered the water lines to be flushed out. To interrupt the 2-minute purge cycle, after 30 seconds, press the purge control button again or simply press the tap-on foot pedal. After the purge cycle is complete, turn the system to the off position. Remove the SteriMate handpiece from the unit. Contaminated instruments should be transported in instrument cassettes, trays with sides, or labeled containers with lids when cassettes are not an option. Occupational safety must be followed by clinicians to reduce the risk of sharps injuries and exposure to contaminated instruments. Instrument reprocessing plays an integral part in routine infection control procedures. Used instruments can harbor bacteria and bioburden and should be transported to the reprocessing area immediately after their use. Clinicians should don all personal protective equipment, or PPEs, while transporting, disinfecting, and cleaning instruments after their use. Clinicians should use the ASTM levels of protection to help determine proper mask selection based on the procedure they are performing. After all soiled instruments and devices have arrived to the reprocessing area, they must be sorted for proper handling and processing. Hand instruments, Cavitron inserts, and handpieces are all cleaned, disinfected, and sterilized in various pathways. It is essential that the manufacturer's recommendations are followed for each individual device being reprocessed. If unable to reprocess the instruments immediately after use, instruments should be pre-soaked utilizing a foaming enzymatic spray like Zymex. Using an enzymatic spray aids in preventing debris from drying and begins to dissolve blood or protein and other bioburdens that may have dried on the instruments. Do not use disinfectants or sterilants for this step. Instruments should be completely covered by foaming solution during the pre-soaking process. Instruments should be cleaned prior to sterilization to remove all bioburden and debris. The CDC recommends the use of automated cleaners. Manual cleaning and/or scrubbing should be avoided to reduce the risk of injury or exposure to the clinician. When an ultrasonic bath or automatic instrument washer are not available for instrument cleaning, manual cleaning is then utilized. Instruments should be scrubbed low in a sink at arm's length, utilizing a long-handled brush with a surfactant or detergent under running water. When manually cleaning Cavitron inserts, pay particular attention to the holes and cannulas to remove debris. Rinse under running water for 30 seconds to remove the cleaning agent. A disposable syringe may be used to rinse the holes or cannulas. After manually cleaning Cavitron inserts, a disinfection step of the device is recommended. Thoroughly wipe all insert surfaces with a disposable wipe in combination with a bactericidal, virucidal, or fungicidal instrument disinfection solution, observing concentration rates and contact times. Pay special attention to disinfect all holes and cannulas. Rinse the insert under running water for 30 seconds to remove the disinfectant solution. A disposable syringe may be used to rinse the holes and cannulas. Automated cleaners increase the efficiency of the cleaning process and reduce the handling of sharp instruments. It is important to follow manufacturer's instructions for instrument cleaning solutions, carefully observing the concentration rates and contact times. A pH-neutral instrument cleaning solution, such as Resurge, may be used for up to 15 minutes in an ultrasonic bath. When placing Cavitron inserts into an ultrasonic bath, the use of an instrument cassette is recommended to reduce the risk of insert damage. Utilizing a cassette for all instruments protects instruments from damage and minimizes the clinician's exposure time to soiled, loose instruments. If cassettes are not an option, place the instruments into a basket. Cavitron inserts should be placed in the ultrasonic bath basket separate from all other instruments to protect them from potential damage. Cavitron ultrasonic inserts may be cleaned using an ultrasonic water bath for up to 15 minutes. A pH-neutral instrument cleaning solution, such as Resurge, is recommended for ultrasonic cleaning with Cavitron inserts for up to 15 minutes. It is important to adhere to the ultrasonic cleaning bath manufacturer's recommended liquid level. Place the device into the ultrasonic bath and ensure that the instruments are sufficiently covered. Place the cover and set the unit for the indicated contact time. After the allotted time in the ultrasonic bath, remove the instruments from the ultrasonic cleaning bath and rinse the inserts under running water for 30 seconds to remove the cleaning agent. A disposable syringe may be used to rinse the holes and cannulas of the Cavitron inserts. Drying instruments completely prior to sterilization will protect the instruments from corroding. Leaving a Cavitron ultrasonic insert wet before the final sterilization step may cause the insert to become stained, corrode, or clog the water ports. As demonstrated here, the use of an instrument dryer can accommodate cassettes as well as loose instruments placed in a basket. Once instruments are dry, they should be inspected prior to packaging and the sterilization process. Visually inspect instruments to ensure all contamination is removed. Repeat cleaning steps if debris is remaining. It is important to visually inspect the O-rings of the Cavitron inserts for wear. If O-rings are showing signs of breakdown or wear, utilize the Cavitron O-ring replacement kit to change the worn O-ring. Lubricate the O-rings with water before use. Monitoring the wear of your ultrasonic inserts is key to ensuring optimal performance. Using an insert that is excessively worn will cause it to operate at substandard efficiency and may cause the clinician to use excessive pressure while scaling, which results in discomfort for both the clinician and the patient. Inspecting the wear of your ultrasonic inserts routinely and replacing them when necessary can help maximize efficiency and comfort. Discard damaged, worn, or corroded instruments. When using an instrument washer disinfector for cleaning and disinfection of instruments, always follow the manufacturer's instructions for use for the unit and instrument washer solution, making sure to observe the concentration rates and contact times as well as the instrument washer's recommended cleaning and/or thermal high-level disinfection cycle. The use of an instrument cassette during an automated cleaning disinfection is recommended to reduce the risk of instrument damage. Place the cassette into the instrument washer and begin the washer disinfector cycle. After the washer cycle ends, remove the instruments from the washer. If the dry cycle wasn't utilized, the cassettes must then be dried using an instrument dryer before packaging and sterilizing. As demonstrated here, the use of an instrument dryer can accommodate cassettes as well as loose instruments placed in a basket. Various types of handpieces are utilized daily in dentistry. All require different care to maintain the life of the handpiece. The CDC's recommended guidelines for reprocessing of handpieces requires heat sterilization methods to sterilize handpieces and all devices that attach to air or water lines. It is important to follow the manufacturer's recommendations for cleaning, lubrication, and sterilization of handpieces being used. Once handpieces have been separated from instruments for reprocessing and the manufacturer's guidelines have been reviewed, reprocessing should begin to prevent any residue or contamination from drying on the device. Begin by removing any moist debris or residue on the SteriMade handpiece by using a disposable disinfectant cleaning wipe like Volo wipes. Rinse the Steramate handpiece under running water. After cleaning the Steramate handpiece thoroughly, disinfect all surfaces of the handpiece by wiping with a disposable wipe in combination with a bactericidal, virucidal, and fungicidal instrument disinfection solution, observing the concentration rates and contact times. After disinfecting the handpiece, rinse under running water for 30 seconds. Dry the handpiece with a disposable towel. Steramate handpieces can be cleaned and disinfected in automated instrument washers. For cleaning and disinfection of these handpieces in an instrument washer disinfector, always follow the manufacturer's instructions for use for the unit and the instrument washer solution, making sure to observe the concentration rates and contact times, as well as the instrument washer's recommended cleaning and/or thermal high-level disinfection cycle. After the dry cycle is complete, always inspect for remaining debris. If debris is still visible, repeat the washer disinfector cycle. If utilizing cassettes for inserts or hand instruments, place the cassette in a paper to plastic steam sterilization pouch or sterilization wrap after ensuring the instruments are completely dry. After following the handpiece manufacturer's recommended cleaning and disinfecting guidelines, handpieces should be packaged in a sterilization paper to plastic pouch. If cassettes are not an option, place the instruments and/or inserts in a paper to plastic sterilization pouch. When loading an autoclave, follow the recommended guidelines for the unit being used for proper placement of cassettes and paper to plastic pouches. If a vertical sterilization pouch rack is being utilized, the pouches may be placed on end during the sterilization process, as seen here. If horizontal trays are used for loading cassettes and sterilization pouches, it is essential to follow the unit's manufacturer recommendations for placement of paper to plastic pouches. Follow the manufacturer's guidelines for the steps in use of the type of autoclave unit being used prior to starting the device. Allow the dry cycle to complete prior to emptying the items from the autoclave. If items are still wet, allow them to dry completely before storing. Now that the soiled instruments have been transported and reprocessing steps are underway, disinfection of the Cavitron Plus unit and its surrounding surfaces must be achieved prior to the beginning of another treatment session. A two-step cleaning process is recommended when visible soil and debris are present on environmental surfaces. The soil and debris must be cleaned prior to disinfecting the surface with a disinfectant wipe or spray. To prepare the unit for the next treatment session, utilize a disinfectant wipe or generously spray disinfectant solution on a clean cloth. Do not spray disinfectant solution directly on the system surfaces. Disinfect the surfaces of the cabinet, power cord, handpiece cable, tap-on foot pedal and cable assembly, and water supply lines. Inspect the handpiece cable for any breaks or tears. After cleaning and disinfecting the Cavitron ultrasonic scaler, it is important to clean and disinfect the surfaces around the unit. The counter surfaces can become contaminated from bacterial aerosol, spray, or splatter. Utilize a disinfecting wipe or disinfection spray to thoroughly remove this debris. Now that the Cavitron scaling unit and surrounding environment has been cleaned and disinfected, and the handpiece and instruments have been taken to the reprocessing area, the unit is ready for use for another treatment session. To prepare the unit for another treatment session, place the sterilized Steramate handpiece onto the handpiece cable assembly. Prepare the handpiece for use by holding the handpiece in a semi-upright position over a sink or drain. Depress the foot pedal until the water exits to release any air bubbles that may be trapped inside the handpiece. After opening a sterilized insert, lubricate the O-ring on the insert with water before placing it into the handpiece. Fully seat the insert with a gentle push-twist motion. Do not force the insert into place. Adjust the system controls according to the recommendations for the insert selected. When the waterline filter becomes discolored, the filter should be replaced to prevent reduced water flow to the Cavitron Plus system. This should be checked and/or replaced monthly. To change the water filter, begin by verifying that the system is turned off. Disconnect the water supply hose from the dental office water supply. If a quick disconnect connector is attached to the end of the hose, relieve the water pressure by pressing the tip of the connector in an appropriate container and drain the water. Grasp the fittings on either side of the filter disc and twist counterclockwise. Remove the filter section from either side of the water hose. Install the replacement filter onto the water hose fittings. The filter should be positioned to match up with the correct hose fitting. Hand tighten one hose fitting onto the filter in a clockwise direction. Tighten the second hose onto the filter in a clockwise direction. Reconnect the water supply line. Operate the unit to bleed the air and test for any leaks. After utilizing the Cavitron Plus ultrasonic scaler, it is essential to disinfect all of the surfaces of the unit and its surrounding environment. This important step will reduce the risk of cross-contamination. To begin, remove the used Cavitron ultrasonic insert and secure it in a cassette or transport container. Hold the handpiece over a sink or drain and activate the purge control button. The purge function will run for 2 minutes. This function will flush out any stagnant water that remained in the lines overnight and releases any air bubbles that may be trapped in the handpiece. Per the CDC recommended guidelines, the handpiece line should be purged for a total of 20 to 30 seconds in between each patient. This allows any patient material that may have entered the water lines to be flushed out. To interrupt the 2-minute purge cycle after 30 seconds, press the purge control button again or simply press the tap-on foot pedal. After the purge cycle is complete, turn the system to the off position. Remove the SteriMate handpiece from the unit. Contaminated instruments should be transported in instrument cassettes, trays with sides, or labeled containers with lids when cassettes are not an option. Occupational safety must be followed by clinicians to reduce the risk of sharps injuries and exposure to contaminated instruments. It is strongly recommended that the Cavitron scaling system be disinfected by chemically flushing the water lines with a 1 to 10 sodium hypochlorite solution at the end of each week. This can be accomplished by connecting this device to the Cavitron Dual Select dispensing system. Follow the steps listed in the Cavitron Plus ultrasonic scaling system directions for use manual. Thank you for viewing this instructional educational video brought to you by Dentsply Sirona.